Good evening everyone. If I'm visible, audible, please send thumbs up in the link. So welcome to NEET PG Marathon Part 2. This is Dr. Pritesh Singh, your surgery faculty. So let's start. First of all, the first question, a 4-year-old boy who was the second child. What is the age of this child? 4-year-old boy who was the second child among 3 in his family, was brought to the hospital, and what is the complaint? Intermittent hematuria with clots and history of crying at each time of urination. Means this patient is having hematuria, there is passage of clots. Passage of clots along with hematuria suggests that the tumor is in the kidney. And what is the age of child? 4 years old child. 4 years old child, tumor must be in the kidney. The abdomen was soft, non-tender. Right side of abdominal wall was, on the right side of abdominal wall there was a mass, and mass was freely movable with smooth edges. So there is mass on the right side. Mass on the right side. The mass did not extend over the midline, so mass is not crossing the midline. Very important finding. Mass, it is not crossing the midline. Clear? And CT scan showed a solid mass with cystic areas in the lower and upper quadrant arising from right kidney. So finally the tumor is arising from right kidney. The hematological assessment showed that the child was suffering from moderate microcytic anemia. So because of blood loss, because of hematuria, the patient is having moderate and microcytic anemia. Probable diagnosis. So again, let's see the clues given in the question. 4 years old child, patient is having intermittent hematuria with passage of clots. The tumor is arising from the kidney. So you tell me, what is the name of this tumor? I'm waiting for the reply. What is the name of this tumor? Yes, the age of child is 4 years. Sonia Shehrawat wants to say that, sir, Gravid's tumor. Gravid's tumor is the other name of RCC. RCC is also known as Gravid's tumor, internist tumor, radiologist tumor. Yes. So what is the correct answer? You tell me, what is the most common primary renal malignancy of childhood? Primary renal malignancy of childhood. Yes. The primary renal malignancy of childhood is Wilms tumor. And if the question is asked like this, that what is the most common malignancy of childhood, then it's the neuroblastoma. But you know that neuroblastoma can cross the midline. Clear? So here there is hematuria. So all of these are pointing towards the diagnosis of Wilms tumor. And now you tell me, this Wilms tumor is characterized by a triad. So what are the components of triad? There is mass, there is fever, there is hematuria. There is mass, there is fever, there is hematuria. And what is the triad of RCC? In RCC, there is mass, there is hematuria, but what? There is pain. In RCC, there is mass, pain, hematuria. And in Wilms tumor, mass, fever, hematuria. So correct answer for this question is C. Majority of you are marking the correct answer. Yes. So this is C. Now question number 2. a 38 years, see the age, 38 years old male with no underlying disease experienced progressive abdominal upliftment, means there is a mass arising from abdomen. That's why there was abdominal upliftment for 8 months. He also mentioned body weight loss of 20 kg over past 2 years. Means the patient is having significant weight loss. What else finding is there? There is gross hematuria associated with flank pain. Means there is mass, there is pain, there is hematuria. This patient is also having weight loss. Okay. On physical examination, you can see significantly palpable and mild tenderness, mild tender mass in the left upper quadrant of abdomen. So on the left side, most probably the tumor is arising from kidney. Patient underwent ultrasound and CT scan which revealed RCC. So RCC is there already in the question, it is mentioned patient is having RCC, but this RCC is invading IVC and renal vein. You know that RCC is having hematological spread. There is vascular invasion. So what happens here? You can see this is the kidney, this is the IVC. In this case, what happens here? You can see the tumor thrombus first invade renal vein and then it invade the IVC. After that, since there is hematogenous spread, what is the most common site of metastasis? The most common site of metastasis, and that is lungs. Lungs. So question, all of the following are true in the management / evaluation of this patient except. So first question, pre-operative biopsy is not necessary. First you tell me what is the investigation of choice for diagnosis of RCC. I am waiting for your reply. Yes, Rohan, Shubhajit Das, Ruthless is again here, Deepa, Gaikwad, Divya Kumari, Diksha, Dhananjay Ghovle. Very good, Dhananjay. Dhananjay, first person to reply. CCT, Harish, Monica. Now everybody is marking CCT, everybody is correct. Divya, Neelam Bhatia, Dr. Rini, Shoaib Khan, Amit Chaudhary, Ganga, Rahul Garg, everyone. So you know that investigation of choice for diagnosis of RCC, that is CCT. Biopsy is not mandatory. Biopsy is actually not required. So pre-operative biopsy is not necessary. It's correct. IVC involvement indicates inoperability. No, even if the IVC is involved, we can resect the tumor. So it doesn't indicate inoperability. Pre-operative radiotherapy is not essential. Yes, pre-operative radiotherapy is not essential in RCC. Chest X-ray could be done to rule out pulmonary metastasis. Yes. Why? Because pulmonary metastasis is the most common site. Lungs are the most common site of metastasis, and you know in the lungs what kind of secondaries are seen. I'm waiting for your reply. I'm waiting for your reply in the comments. What kind of secondaries are seen in lungs in RCC? Tell me. What kind of secondaries? I'm waiting for your reply. Very good, Manish, Amit Chaudhary, Shoaib, everybody is marking cannonball secondaries. Clear? So this is also correct. So which option is incorrect? B. So correct answer will be here B. Okay. Now next question. A 44 years old female patient was admitted to your hospital with 6-month history of progressive bloating sensation in the abdomen. Patient is a female. Okay. The patient had family history of tuberous sclerosis. Now see, these are the clues. Female patient, history of tuberous sclerosis running on his maternal side. On her maternal side. On palpation, a mass was identified in left lateral abdominal area. Patient underwent ultrasound examination. Hyperechoic mass. There is a large tumor. 10 centimeter large tumor, but patient is not having symptom, only there is bloating sensation. Possibly originating from left kidney. Furthermore, CT revealed mass with mixed density. 8 into 10 into 12 centimeter. Lesion appeared to arise from left kidney, displacing the kidney to the right. Biopsy of mass was done, sent for immunohistochemistry, which came back positive for HMB45. So on the basis of 3 clues only, you tell me the diagnosis. First, a female patient. Second, it is associated with tuberous sclerosis. Third, tumor is arising from kidney. And fourth, HMB 45. It is positive for HMB 45. Tell me guys, what's the diagnosis? I'm waiting for your reply. Yes? Waiting for your reply. Somebody is marking a secondary of malignant melanoma. No, see, tuberous sclerosis association is there. Yes, Ayushi, you are correct. Hemant, yes, it is not malignant melanoma. It is angiomyolipoma. You know that both malignant melanoma as well as angiomyolipoma are positive for HMB 45. Clear? But association with tuberous sclerosis, origin from kidney, all these are suggestive of angiomyolipoma. And you break the tumor. Break it. It is of mixed density on CT. So angiomyolipoma, can you tell me the components? Angio means blood vessel, myo means muscle, lipoma means fat. So muscle, fat. So blood vessel, muscle and fat. And whenever you are going for CT, typically the fat appears how? Black, relatively black. It is having minus 20 Hounsfield unit. So it is typically appearing black. So image based questions are also asked in relation to angiomyolipoma. What is the correct answer? See, these are the next best pattern questions where integration is there between radiology, between surgery and between pathology. Some of you are having fear for lengthy questions. You should not have any kind of fear for big questions or lengthy questions. Why? Because if a question is one-liner, the information is provided into few words. But if it's a lengthy or big question, lots and lots of informations are provided, and it is very easy to pick the correct answer from lengthy questions. Okay? So chances of marking a question correctly is directly proportional to length of the question, how big the question is. Clear? Don't have any kind of fear. So correct answer here is angiomyolipoma. Thank you, AK47. Now, next question. See, 3 years old child comes with complaints of swelling in scrotal region. Where is the swelling? See the age of child. 3 years old child. Swelling in scrotal region. On examination, the swelling increases in size when the child cries. Ultrasound revealed hydrocele of hernia sac. Hydrocele of hernia sac. What do you mean by hydrocele of hernia sac? It means there is collection of fluid in hernia sac. There is collection of fluid in hernia sac. How? Have a look. See the image. This is the image. Here you can see this is the testis. This is the cord. You can see this is the sac. And this sac is plugged by omentum, or sometimes there is obliteration. Because of that, what will happen? In this sac of hydrocele, there is fluid collection. So whenever fluid collection occurs in the sac of hernia, that is known as hydrocele of hernia sac. So how will you treat? It is not actually hydrocele. Actually, it is hernia. So if a child is having hernia, what you have to go for? We will go for herniatomy. So even if a child is having congenital hydrocele, in which there is communication with peritoneal cavity, or there is hydrocele of hernia sac, what's the treatment? The treatment is herniatomy. Let's see how many of you marked the correct answer. Ujjwal Shukla, Ayushi, Diksha Shrimali, Sonia Shehrawat, Chandrakanta Halder. Yes, majority of you marked the correct answer. So correct answer here is herniatomy. It is herniatomy. Very good. Next question. These kind of questions are expected in NEET PG. Tell me the correct answer. In NEET PG as well as in INI-CET, they are asking lots and lots of questions about Foley's catheter, the color coding of Foley's catheter, cannula, size of cannula, color coding of cannula, flow rate of cannula. These are the questions. Okay. So what does F stands for in Foley's catheter in size 16F? So F means it is French. It is French. So how will you convert French into mm? Yes. So French is equal to external or outer diameter of catheter. External or outer diameter divided by 3. Divided by 3. So tell me, if the size of catheter is 18 French, tell me what's the size in mm? The question for you people, if the size of catheter is 18 French, what is the size in mm? I'm waiting for your reply. Abhinav Kumar, first person to reply correctly. Now Reformer, Trilok Chand, Rahul, Devesh, Ayushman, Monica. Now everybody is marking correctly. So obviously it is 18 by 3, that is 6 mm. So remember, it's the external diameter divided by 3, that is the French. So here what's the correct answer? External diameter. Okay. The questions which are frequently asked, color coding and French of Foley's catheter. Okay. So see here. Gray is 10 French. White is 12 French. Green, that is 14 French. Orange 16 French. Red 18. Yellow 20. Violet 22. Blue 24. Clear? Now how to remember? There is a mnemonic. And what's the mnemonic? It is gray white. What's the mnemonic? Mnemonic is gray white gory Valentine babe. You know, in Feb all of you are waiting for Valentine's Day. Yes. So gray white gory Valentine babe. Now see, what's the size? In gray 10, white 12, G means green. Green is 14. Green is 14. O means orange. Orange how much? It is 16. R means red. Red is how much? 18. Y means yellow. Yellow is how much? 20. Then Valentine is violet. Violet is 22. And babe means blue. Blue is how much? 24. Clear? Okay. Okay. So Harish wants to say that Valentine's Day not trustworthy. It's fine. It's fine. Okay. It's your personal choice. So gray, white, gory, Valentine, babe. This is how you will remember. Gray is 10 French. White is 12. Green, that is 14. Orange 16. Red 18. Yellow 20. Valentine is violet 22. Blue, babe, that is 24. So you have to remember cannula as well as Foley's color coding and their size. Right? Next question. A famous question, almost every year this question is asked in exam. Which of the following is not a criterion for SIRS? Yes? So tell me, I'm waiting for your reply first. Waiting for your reply, guys. Yes, Laksh, Sheel Patel, Priyanka Soni, Shoaib, Abhinav Kumar, Dr. Sarika, Amit Chaudhary, Ayushman, Dreamer, Avinash, Shubhajit, Divya Kumari, Deepa. Okay. Now, see how to remember. It's very easy to remember. SIRS. The mnemonic is THR counts. How to remember? It is THR counts. T means temperature. How much should be the temperature? 38 degrees centigrade, more than or less than 36 degrees centigrade. H means heart rate. How much? More than 90 per minute. R, that is respiratory rate. How much? More than 20 per minute. Or there is one more thing which is included. What? PaCO2 less than 32 mmHg. Count means WBC count. And how much should be WBC count? Either more than 12,000 per microliter or less than 4,000 per microliter. Or on peripheral smear, more than 10% of immature cells. More than 10% of immature cells. Okay. So now everybody is marking, everybody started marking. Ritu, Diksha, Abhishek, Ruthless, Harish, everybody started marking. How much? What's the correct answer? D. Systolic BP, it is not included in SIRS. Systemic inflammatory response syndrome, this is the mnemonic. Out of total 4 parameters, how many should be positive? More than equal to 2. Okay, so SIRS, very, very important. Correct answer is D. Now this question, almost every year this question is asked in exam. Every year, only there is slight variation in the language, or sometimes they are going to change the options. Otherwise, the heart and the soul of the question remain same. It is tension pneumothorax. Read the question. 25 years old patient of road traffic accident brought to the emergency after road traffic accident. Respiratory rate 35 per minute, means patient is having tachypnea. Blood pressure 100 by 60 mmHg, means patient is having hypotension. With difficulty in speaking sentences. On percussion, hyper-resonance note was heard on entire right side of chest. What you can notice on the entire right side of chest, there is collection of air under tension. Ipsilateral lung is collapsed. Fast was performed, it was normal. Means abdominal findings are not there. It was not E-fast. Fast was done. Chest X-ray is given below. What is the next immediate step? So all of you know that this is a case of tension pneumothorax. Why it is a case of tension pneumothorax? Tell me. Because in tension pneumothorax there is dyspnea, there is tachypnea, there is absent breath sounds on auscultation, and if you do the percussion, because the air is collected under tension, there is hyperresonance. These patients have distended neck veins, these patients have hypotension. Why hypotension? Because excessive air is going to compress the major vessels like superior vena cava, inferior vena cava. It decreases venous return, and that's why patient is having hypotension. So HRCT chest, don't send the patient for CT. Patient will expire in radiology department. Wide bore needle insertion where? 5th intercostal space. You tell me, the wide bore needle in adults should be inserted in 2nd intercostal space or 5th intercostal space? I'm waiting for your reply. It is inserted in 2nd intercostal space or 5th intercostal space. I'm waiting for your reply, guys. Saif is also there. Saif Ali Khan is there. Very nice. Yes. Everybody. Ayushman. Okay, only 2-3 people wants to say 2nd intercostal space. Rest everyone wants to say it's 5th intercostal space. Let me tell you, previously it was said that put a wide bore needle in 2nd intercostal space. But at present, in adults, the site of needle insertion and the site of chest tube insertion is same. 5th intercostal space in anterior axillary line. Only in children, the needle should be inserted in 2nd intercostal space in mid-clavicular line. You have to remember this latest advancement, ATLS update, that in adults, the site of needle insertion as well as the site of ICD insertion is same. It is 5th intercostal space. So correct answer, wide bore needle in 5th intercostal space followed by ICD in 5th intercostal space. This is correct. Wide bore needle in 5th intercostal space only? No, because you have to go for definitive treatment. And what is the treatment of choice? That is chest tube insertion. Immediately shift the patient to OT for thoracotomy. Only tension pneumothorax, it's not an indication for thoracotomy. So what is the correct answer here? B. I'm telling you again, almost 100% chances are there we are going to get a question on SIRS, on Q-SOFA, on tension pneumothorax in the NEET PG. There are almost 90 to 100% chances. Now what happens here? See the pathophysiology. You can see here there is collection of air here, and this air is collected. So what will happen? The ipsilateral lung is collapsed. In this image also you can see that this is the ipsilateral lung which is collapsed. There is shift of mediastinum. This is air, and here you can see most characteristic feature, what? Depressed diaphragm. So these are the findings which are given below. If you want to see here, you can notice that there is collapsed lung. Here you can see the collapsed lung, depressed diaphragm is there. So again, it is a case of tension pneumothorax. Now, one question for you people. How will you make the diagnosis of tension pneumothorax? Investigation of choice for diagnosis of tension pneumothorax. Chest X-ray, first option chest X-ray, second option CT, and third option clinical diagnosis. Tell me, investigation of choice for diagnosis of tension pneumothorax. Chest X-ray, CT, or it's a clinical diagnosis? I'm waiting for your reply. AK-47, first person to reply. AK-47, yes, very good, very nice, very good, very good. So the crowd is divided, you know, almost 40% patients are, 40% students are marking clinical, 50% are marking chest X-ray, some of you are marking CT. Let me tell you, in chest trauma for two conditions, what, tension pneumothorax and for flail chest. For tension pneumothorax and for flail chest, the diagnosis is clinical, just by clinical signs and symptoms. So don't send the patient for X-ray or CT, otherwise some patients are going to expire in radiology department. So here you have to highlight one very important point, that in tension pneumothorax, diagnosis is clinical. It's a clinical diagnosis in two cases, in tension pneumothorax, and in flail chest. In tension pneumothorax and flail chest, the diagnosis is clinical, you have to remember. Okay. Next question, Q SOFA. And you can't believe this Q SOFA was asked in FMGE last week. Only last week this question was asked. So all of the following are, which of the following are component of Q SOFA? How to remember Q SOFA? The mnemonic is QRSMS. What is the full form of Q SOFA? This is Quick Sequential Organ Failure Assessment. Quick Sequential Organ Failure Assessment. Q, that is Q SOFA. R, that is respiratory rate more than equal to 22 per minute. S, that is systolic blood pressure, how much, less than equal to 100 mmHg, and MS means mental status alteration. The MS is mental status alteration, that is MS. Clear? For each, the score of 1 is assigned. So what? Systolic blood pressure, respiratory rate, alteration in mental status or neurological status. So heart rate is not included. Correct answer is 1, 2, 4. It is B. Let's see. Everybody is marking correct answer B. Everybody is marking B as a correct answer. Very good. Very good. G2 wants to tell us the mortality also. Very good, G2. So correct answer is B. Now the question, color coding of cannula. Tell me what is the gauge of this cannula. It's a pink cannula. Pink cannula, what's the gauge? Tell me, I'm waiting for your reply. What is the gauge of pink cannula? Yes guys, I'm waiting for your reply. Everybody is marking correct answer. 20, 20, 20. Who marked 16? Very bad. It's 20. It's 20 gauge. That is pink cannula. Now what are the questions related to cannula? They ask you first the color coding and the size, and then they ask you what? The flow rate of cannula. So it's very important. Correct answer is C. Now see the color coding. Okay, here you can see, first see the colors. This is orange. Orange is 14 gauge. This is gray. Gray is 16 gauge. This is green is 18 gauge. Pink, that is 20 gauge. Blue is 22. Yellow is 24 and violet is 26. Clear? So now how to remember? The mnemonic is organize green pink. Organize green pink by violet. Organize green pink by violet. OR means orange. Orange is 14. G means grey. Grey is 16. Green 18. Pink 20. Blue 22. Yellow 24. Violet 26. So remember, mnemonic is organize green pink by violet. Orange 14. grey 16, green 18, pink 20, blue 22, yellow 24, violet 26. What are the cannulas which are most commonly used? You have seen in medicine ward they are using pink cannula, and in surgery we use green cannula, and in pediatrics you have seen they use blue and yellow. In pediatrics, what you have to remember, you have to remember the flow rate also. Maximum flow rate is for the orange, that is 240 ml. After that grey 180. Green is just half of grey, how much? 90. In pink it is 60. Blue 36 ml, yellow 20 ml, and violet 13 ml. Okay. So somebody wants to say which one for trauma. Specifically for blood transfusion we prefer the green one. But if you want rapid transfusion, then go for the orange. If orange is not available, then grey. So I'm repeating again, Foley's catheter, cannula, these are very, very important topic. Again a repeat question, similar questions have been asked in the past. Elderly patient fell in the bathroom. Let me tell you two kind of histories. There is a male patient, okay, and what happens in male patients? They have BPH. That's why they have nocturia, elderly males. So that's why in the night they get up and they go to washroom and they go washroom for passing urine. What happens? If the floor is slippery, what happens? Sometimes they fell on the ground and there is head injury. Because of that there is STH. Similarly, if a female patient is there and she slips in the washroom, an elderly female, means there is postmenopausal osteoporosis, you have seen this kind of history that there is fracture neck of femur. So these are the two classical histories. So there will be head injury. So what happens? Fell in the bathroom in early morning hours, was rushed to the casualty. GCS is low, 9/15. Urgent NCCT was done. And what you can see on CT, can you tell me what is the name of this sign? What kind of hyperdense lesion? It is concavo-convex. This is what? This is concavo-convex hyperdense lesion, and this concavo-convex hyperdense lesion, this is SDH. Subdural hematoma. This is SDH. Subdural hematoma or subdural hemorrhage. Yes, everybody is correct. Very good. Everybody, banana sign, yes. Crescent, yes. Moon, yes. Very good. It looks like banana, crescent or moon. This is concavo-convex hyperdense lesion. Now see the rest of the questions which are asked in relation to head injury. First, whenever there is fracture of this weakest point of skull, you know that is pterion, and just beneath pterion there is an artery. Which artery? Middle meningeal artery. So whenever there is rupture of or trauma to this middle meningeal artery, blood is collected between skull and dura. If blood is collected between skull and dura, this is known as extradural. And whenever the blood is collected between dura and arachnoid, this is dura and this is arachnoid, this is subdural. It is caused by injury of which veins? Bridging veins or cortical veins. These are the two questions which are asked. EDH. EDH is caused by injury of which artery? Middle meningeal artery. And you know that SDH. SDH is caused by injury of cortical veins or bridging veins. Now you people tell me that in EDH and SDH, lucid interval is positive in which case? I'm waiting for your reply. In EDH and SDH, lucid interval is positive in which case? Tell me guys, lucid interval. Divya Kumari Sangam, yes, everybody is marking. Aditya, Kavya, Shri, Sumit, Ruthless, Ganga, Sanjeev, Neelam, Shefali, Likhit, XYZ is also there, Priyanka. All of you are marking the correct answer. Lucid interval is present in or seen in EDH, and here you can see biconvex or lenticular shaped hyperdense lesion, and all of you know how we are going to drain it. In both of these cases, if a small hematoma is there, we drain it by burr hole, and if large hematoma is there, we drain it by craniotomy. So how we are going to drain it? burr hole or craniotomy. Clear? This is another important question. Tell me the correct answer. Tell me the correct answer, guys. I'm waiting for your reply. Tell me the correct answer. Yes, this question is also expected in NEET PG. I'm telling you, erysipelas and cellulitis. The question is expected in NEET PG. Yes. Now, see the description. What you can see, reddish orange color, okay, inflammation, which is having, you can see here, well defined margins. Which part of body is involved? You can see cheek, bridge of nose as well as nose. So typically this is what erysipelas, and this is typically most commonly caused by streptococcus. It is most commonly caused by streptococcus. Clear? So ruthless, Ramesh, majority of you are marking correctly. So there is cellulitis and erysipelas. Both of these are most commonly caused by streptococcus, but in cellulitis even Staph aureus is also responsible. Staph aureus is also responsible. Now see the differences. The well defined margins, where in which case there is well defined margins. So here you can see the well defined margins are seen in erysipelas, but in cellulitis there are ill defined margins. Here in erysipelas there is involvement of upper subcutaneous tissue and lymphatic vessels, but in cellulitis deeper subcutaneous tissues are involved. And if you have attended surgery emergency, you have seen many patients of cellulitis are especially coming in rainy season, and they have involvement of which part of leg, which part of body? Legs. And majority of these patients, you are going to notice that they have diabetes mellitus. Clear? So for cellulitis, most commonly strep pyogenes, but Staph aureus is also responsible. You tell me, vesicles and bulla formation, it is more common in erysipelas. Only in severe cases of cellulitis we are going to find what? Bulla. And whenever a patient of cellulitis is coming, we have to treat these patients aggressively. Clear? So you have to remember the differences. So correct answer for this question is streptococcus. It is streptococcus. Okay. Now next question. This is again a potential question. In each and every exam there is one question related to GCS, Glasgow Coma Scale. At least one question is there. Sometimes it is asked in medicine, sometimes it is asked in surgery. You tell me what is the correct answer here. After trauma, the patient was having spontaneous eye opening. This patient was having spontaneous eye opening with tracheostomy. Means obviously you cannot assess the verbal response. Not able to move his right upper limb. Can anybody tell me why he is not able to move his right upper limb? Why this patient is not able to move? Because there is fracture in right upper limb. So that's why we have to assess the best motor response. Localizes pain in left upper limb. Tell me what is the Glasgow Coma score? How much is the GCS? This is very tricky question. Yes. Very good, Diksha. Very good. Very good. Yes. Everybody, almost everybody is marking correct answer. Everybody. Now, spontaneous eye opening. This is E4. Verbal response. Since there is tracheostomy, it cannot be assessed. So, NT. Okay, it cannot be assessed. After that, M. How much? Localizes pain? 5. So, total score is 9 VNT. Clear? Imagine if I am going to remove this VNT, then imagine I am going to remove these two options. Only you have to choose between A and C. Yes, you have to choose between A and C. What's the correct answer? Tell me, guys. Yes? Now you are stuck. Some of you are marking 9, some of you are marking 10. Let me tell you, additional score of 1 is not assigned for any parameter which cannot be assessed. So if the parameter which cannot be assessed, for that additional score of 1 is not assigned. So either it is 9 VNT, and if VNT is not given, then the correct answer will be what? 9. So what? Correct answer is 9, and if NT is given, then obviously it is VNT. What examiners are doing nowadays, they don't mention NT. They just mention what? The exact number. So if NT is not mentioned, you are not supposed to assign additional score of 1. What you have to mark? 9. And if VNT is given, in that case, this is the correct answer. So let's quickly revise the GCS. This is electron voting machine, EVM. So what? Eye opening, verbal response, motor response, and it is best motor response. So first question for all of you, out of EVM, which one is the best predictor of survival? I'm waiting for your reply. Best predictor of survival in GCS. The answer is self-explanatory. Best predictor of survival. Again, it is written what? Best motor response. Clear? That is the best predictor of survival. Now what is E4? Spontaneous eye opening. E3, initially patient was opening eyes to loud voice, now to speech. Initially it was included that opening eyes to pain, now we are applying the pressure and patient is opening eye. Even there is no response. V5, when person is oriented to time, place and person talking. V4, when person is confused or disoriented. V3, if patient is speaking inappropriate words, which should not be, means sometimes the patient is abusing the relatives. So inappropriate words. And V2, patient is producing some kind of sounds, A, E, O, which you cannot comprehend. And V1, that is no response. Now the motor response, M6, when patient obeys commands. M5, when patient is localizing pain. M4, when there is withdrawal to pain, you pinch the skin and patient is going to withdraw one of the limb. M3, abnormal flexion posturing. M2, extension posturing, no response. Okay. So some of the students are facing some difficulty in remembering this GCS. It is very, very easy to remember. There is a mnemonic. See, eye opening, only 4 parameters are there in eye opening. So you can remember this. How to remember verbal response? One confused word. One confused word. Sounds nowhere. One confused word sounds nowhere. So here the score is 5, 4, 3, 2, 1. O means oriented, confused means confused, words means inappropriate words, sounds means sounds or incomprehensible sound, nowhere means no response. And how to remember motor response? Obey localities. Mnemonic is obey localities with flexion and extension. Obey localities with flexion and extension. So obey commands, that is 6, localizes pain, localities 5, withdrawal to pain 4, flexion posture 3, extension posture 2, no response 1. So you have to remember, and any parameter which cannot be assessed, yes, we are going to add NT in front of that parameter, and in final score, additional score of 1 should not be added. Clear? So this is GCS. Another repeat question. Similar questions have been asked in the past. Tell me, what is the correct answer? A 40-year-old male with blunt trauma was brought to the emergency with pulse rate 120 BP 80 by 50. You tell me what is the definition of unstable patient. You have to remember definition of unstable patient: pulse rate more than 100, systolic blood pressure less than 100. Unstable means pulse rate more than 100, BP systolic BP less than 100. So here it is more than 100 per minute. This is less than 100 mmHg. Any patient of blunt trauma abdomen is brought to your emergency. Doesn't matter patient is stable or unstable. What is the first investigation done? The first investigation done, it is fast. It is fast. So what we go for? Fast. Now imagine after fast still patient is unstable, you try to resuscitate the patient with IV fluid, still unstable patient. After fast state the patient for laparotomy. And if patient is stable, fast is positive, patient is stable, fast is positive, gold standard investigation for stable patients. Gold standard investigation for stable patients, that is CCT. Clear? So these are frequently asked questions related to blunt trauma abdomen. Now see the next question. Correct answer is A. Just by looking at the image, tell me what is the diagnosis. Clear cut question. Easy question. Samanvay Pratap Singh, tell me Prashant, Pankhudi, Monica, Shoaib, Kadu, Priyanka Singh, Priyanka Soni. Priyanka Soni wants to ask that, sir, without GT can we get 500 marks if your preparation is up to the mark? You have practiced questions, subject wise questions, you can. But see, before going to the war, you should practice, right? So if you simulate that kind of environment with GTs, yes, at least 3 to 4 just for your practice, at least at this point of time, right? Go for it. Because what happens if a long duration paper is there, after 1 hour we are mentally tired, we are exhausted. So whenever you are practicing question papers, what you should sit with a watch clock in the room, and during that particular period of time only you should solve the questions. So you should practice. So it's a clear cut case of varicocele. See question. 35 years old male came to OPD with swelling in left scrotal region and pain. Pain increased on standing and evening on palpation. Feel like bag of worm. So there is bag of worm like sensation here. You can see this is varicocele. What happens in varicocele? There is dilated, tortuous, pampiniform plexus of veins. On which side it is more common? Left side. It causes reversible atrophy of testes. How we diagnose it? Doppler. Because what happens? There is increased vascularity, and if you see this pampiniform plexus of veins location, it is located, this was asked in NEET PG, posterior and above testes. It is located posterior and above testes. Clear? So here the correct answer is varicocele. Next question. Easy question. Read the question. After that you can easily mark the correct answer. A patient presented to emergency with claudication of calf muscle, numbness in thigh and impotence. Image shows the gangrene of foot. So what you can see, there is problem in thigh, problem in calf, problem in foot. It means whatever the vessel which is occluded, that is above the level of thigh. Since there is impotence, why there is impotence? Because there is compression or the flow of internal iliac is not sufficient. What happens? See, the erection, penile erection, it is because of parasympathetic system. So during erection there is increased blood flow to the penis. So at the time of erection, if there is no increased blood flow to the penis, penis is not erect. So this patient is not able to penetrate the vagina. So this is impotence, and it is known as what? Leriche syndrome. This is known as Leriche syndrome. And what is the cause of this Leriche syndrome? Very good. Somebody, yes, Chanchal wants to say there is aortoiliac bifurcation. Obstruction is at the level of aortoiliac bifurcation. See the diagram. Here you can see the anatomy, and you can see this is the aorta, this is the internal iliac. Clear? So what happens, since there is decreased blood flow in the internal iliac, it must be, the obstruction must be at the level of, yes, above the level of internal and external, means the common iliac must be involved. That's why the obstruction is at the level of aorto-iliac bifurcation. This is aorto-iliac bifurcation. That's why patient is having impotence. Patient is having problem in the thigh, in the calf, as well as in the foot, everywhere. So whenever a vessel is occluded, the symptoms are seen distal to that. So obviously, what is the correct answer here? Aorto-iliac bifurcation. If only internal iliac artery is involved, there should not be any claudication in the limb. If only popliteal artery is involved bilaterally, what? There is no Leriche syndrome or impotence, and even if femoral artery is involved, there is no impotence. So what is the correct answer? A. Correct answer is A. Venkat wants to ask that, sir, will we get PDF? Yes, you will get. Don't worry, you will get. Okay. Again, a potential question. Let me tell you, we are expecting a question related to pressure ulcer or pressure sore in NEET PG. And question is, they will give one image and they will ask that what is the stage of pressure or grade of pressure sore. So simple question. See, whenever there is only erythema, if there is only erythema without any breach of epithelium, this is 1. If there is involvement of only epidermis, this is 2. If there is involvement of epidermis plus dermis plus subcutaneous fat, this is 3. And whenever there is involvement of skin plus muscle and it is up to bone deep, whenever you can see the bone, this is 4. So in this case, can you see the sacrum, part of sacrum? So sacrum is exposed. Clear? So most probably this is a patient of paraplegia, bedridden for 15 years. Whenever a patient is bedridden, in majority of these cases, I am telling you the answer also, in majority of these cases you can see the bone, and when the bone is exposed, that is grade or stage 4. So correct answer is here D. We are expecting potential image based question related to this topic. So see how it looks like. Whenever the patients are having only erythema, if there is only erythema, this is stage 1. Whenever there is involvement of only epidermis, stage 2. If there is involvement of epidermis, dermis, subcutaneous tissue, all 3, 3. And whenever apart from skin there is involvement of muscle and bone, this is stage 4. So here you can see there is involvement of skin, partial thickness skin loss including epidermis, stage 2. In this case, you can see here that there is presence of granulation tissue, there is involvement of epidermis plus dermis plus subcutaneous tissue. This is stage 3. And in this case, you can see the bone. So whenever there is involvement of muscle and bone apart from skin, this is stage 4. I am telling you again, we are expecting a question related to pressure ulcer in the NEET PG. Okay, Monica wants to say that, sir, in exam the images will be blurred. Yes, the images will be blurred, but what happens? The core thing is visible. See, suppose if the bone is visible, you can easily predict that yes, this is the bone, right? Why? Because in the surrounding area you can see that there is muscle, there is subcutaneous tissue, and the depth is there. Here you can see in the images. Tell me, if you see stage 2, hardly just there is partial thickness skin loss, nothing else is visible. It means you will be confused in exam only in stage 3 and stage 4. Clear? In stage 3, muscle will not be visible. So whenever muscle or bone is visible, what straightforward it is? Stage 4. And let me tell you the answer also. Actually, it's difficult to get the image of stage 3 bed sore, because whatever the patients are there who are bedridden, in majority of them it is the stage 4. So I'm not telling that always the correct answer is stage 4, but in most of the cases it is stage 4. By the way, you have to read the question carefully, look for the image and then mark the correct answer. Next question, again a frequently asked image based question, asked in pathology, asked in surgery, asked in ENT. Patient with history of chronic alcoholism presented to OPD with whitish patch whose image is given below. What is the most probable diagnosis? And everybody is marking leukoplakia. So whitish patch, which cannot be given another name, which cannot be rubbed off, it is leukoplakia. Reddish mucosal plaque, erythroplakia. And whenever there is reddish mucosal plaque intermingled with whitish patch, it is known as speckled erythroplakia. See how it looks like? Now see how it looks like. In the image you can see this is the whitish patch which cannot be rubbed off. This is the reddish mucosal plaque, and here whitish areas intermingled with reddish mucosal plaque. This is speckled erythroplakia, also known as erythroleukoplakia, also known as leukoerythroplakia. Now one question for all of you, out of these three, which one is having maximum risk of malignancy? This question is for all of you. Tell me, which of the following is having maximum risk of malignancy? Tell me. I'm waiting for your reply. Dr. Animesh, very good Animesh. Animesh, very good. Now everybody is marking correct answer, very good. Speckled erythroplakia, that's having maximum risk, followed by erythroplakia, and there is minimum risk in leukoplakia. So maximum risk of malignancy is seen in speckled erythroplakia. Everybody is very good. Dr. Reformer, that is in erythroplakia 17 times. Very good. Ankur Chatterjee, Ruthless, Gauri, everybody wants to mark the correct answer. Speckled erythroplakia is having maximum risk. Okay. Now see the next question. Again I'm telling you, this is a potential question expected in the exam. This topic is expected in the exam. There will be one question related to Fournier's gangrene or necrotizing fasciitis. Okay. Now see the question. 26 years old male operated for redness over the perineal area. Post-op day 5 image is given below. Which of the following statement is correct about this condition? This is Fournier's gangrene. First, see how this gangrene looks like. It is a type of necrotizing fasciitis involving perineum. Can you see here? Necrotizing fasciitis. How to remember majority of terms in surgery? The terms are self-explanatory. So it is necrotizing fasciitis. It means the structures till fascia are involved. The structure beneath fascia are spared. So skin, subcutaneous tissue and fascia is involved. Underlying structures like muscle, it is spared. Penis, urethra, cord structures, yes, all these are spared. Testis, so urethra, cord structure, testis, vas deferens, all these are spared in Fournier's gangrene. This is necrotizing fasciitis. It is caused by mixed group of organisms, and it is both what? Aerobe plus anaerobe. Aerobe and anaerobe. Now see the question and see the options. Caused by mixed aerobic anaerobic infection, correct. Urinary diversion is required in all patients. It is not required in all patients. In some patients, after debridement, here you can see this was the dead skin. Dead skin was debrided. After debridement, we are supposed to insert Foley's to prevent the infection. But Urinary diversion is not required in all cases. Bilateral orchidectomy should be done. No. Actually, testis is spared. Cord structures are spared. Anti-gas gangrene should always be given. Anti-gas gangrene is given in which condition? Yes, tell me the condition which is caused by Clostridium welchi. So obviously the patient who are having gas gangrene, then only we give AGS, anti-gas gangrene. So what is the correct answer here? The correct answer for this question is A. Yes, very good. Majority of you are correct. Next question. Again, it's a potential question. We are expecting this question in exam. Similar question. And what's that? Whenever we are stripping the varicose vein, what is the most commonly injured nerve? A 64 years old male patient underwent CABG, coronary artery bypass grafting, for which graft was taken from great saphenous vein. Patient is now complaining of lack of sensation over medial aspect of leg and foot, associated with heel pain, most likely nerve affected. Yes, so whenever we are stripping great saphenous vein, most commonly injured nerve, it is saphenous nerve. It is saphenous nerve. And whenever we are stripping short saphenous vein, you guys tell me, which nerve is most commonly injured? During stripping of short saphenous vein, which nerve is most commonly injured? I'm waiting. Yes, very good. Dr. Sarika, sural. Very good. Now everybody is marking correct answer. Abhishek, Priyanka, Ira, Reformer, everybody is marking correct answer, that is sural. Short saphenous, it is sural. Another question, and this question was asked last week in FMGE. You know that nowadays for varicose vein, the gold standard treatment is endothermal ablation. The gold standard treatment nowadays, it is endothermal ablation. So how we are going to manage the patients? Patients are managed by radio frequency ablation and endovenous laser ablation. This is radio frequency ablation and endovenous laser ablation. Okay, so correct answer is here saphenous nerve. It is saphenous nerve. Next question. Again, this question is being asked continuously in the exam for the last 3-4 years in each and every exam. NEET PG, FMGE, INI-CET. Everywhere the question is asked. 9 years old male child brought to the emergency by mother with difficulty in swallowing. See the history. Difficulty in swallowing. For past 5 hours, he was noted to play unsupervised. X-ray was taken, identify the location of foreign body. This is a coin and this child swallowed the coin. He was having difficulty in swallowing. Imagine the question was like this, that child was playing unsupervised and he was having difficulty in breathing. Patient is having dyspnea. Then where is the foreign body? And if patient is having dysphagia, then where is the foreign body? Dyspnea, it is in trachea. Dysphagia, it is in the esophagus. When foreign body goes in the esophagus, if you go for chest X-ray PA view, on PA view you can see the flat surface of coin, and on lateral view you can see the edge. How to differentiate? See first, when coin goes in trachea, on PA view you can see the edge, and on lateral view you can see the flat surface. But in esophagus, on PA view you can see flat surface, lateral view edge. Symptom in trachea, patient is having dyspnea. This patient is very symptomatic. Immediately brought to the hospital. A patient might die. This patient, sometimes these patients are not going to tell the parents. Why? They swallow the coin. Coin goes into esophagus, it crosses cricopharynx. Patient is having difficulty in swallowing, but patients means the kids are not telling parents because they know कि अगर मम्मी पापा को बता दिया तो बहुत मार पड़ेगी. They will beat us ruthlessly. That's why they are not telling. Means the symptom is not that much severe, and within 48 hours or after that patient is going to pass the foreign body in the stool. So either patient might be asymptomatic or there is dysphagia. Clear? So tell me correct answer. Where is the foreign body? Yes. Very good, dysphagia. Everybody is marking the correct answer. So it is in the esophagus. Okay. Sometimes what happens, the patients are bringing the kids. Let me tell you, nowadays the cases of foreign body ingestion, means the swallowing of foreign body, has decreased exponentially, especially coins. Can you tell me why? Because when we were the kids, at that point of time, 10 paisa, 20 paisa, 25 paisa, 50 paisa coins were there. And nowadays minimum is 1 rupee coin. When we were kids, we were highly interested in the coins. Yes, but nowadays kids are not interested. If you visit your relative's place and you give some coins to the kids in the family, yes, the relatives are offended. And the child will also not accept the coin. If you give the coin, the child will throw his or her piggy bank towards you. Nowadays, the childs are accepting, directly phone to phone or Google Pay or Paytm, like that. And if you are giving cash, they accept minimum the biggest one of pink color. Which one? 2000. Okay. So nowadays it's rare. Okay. This question is potential question. We are expecting a question. Now another question. It's integrated question with anatomy, integrated question of anatomy and surgery. On removal of submandibular gland and its duct, which of the following nerve is most commonly injured? So before replying the question, see the anatomy. If you see here, this is submandibular duct and this is the gland. If you see, it is closely related to lingual nerve and second, hypoglossal nerve. So whenever we are performing the surgery related to submandibular gland, submandibular duct, most commonly injured nerve, lingual. Second most commonly injured nerve is hypoglossal. Clear? So what is the correct answer? Most commonly injured nerve, lingual, followed by second most commonly injured, hypoglossal. So correct answer is A, lingual. Again, every year there is a question related to shock, and you know which type of shock is most important? Hypovolemic shock. And most of the patients you are going to find in surgery, because these patients are having trauma, hypovolemic shock. So class 3, so there are 4 classes of hypovolemic or hemorrhagic shock. What is class 1? When blood losses from 0 to 15% of blood volume. This is class 1. Class 2, whenever it is 15 to 30. Class 3, whenever it is 30 to 40. And class 4, when it's more than 40. So what is class 3? Whenever the blood loss is 30 to 40. Let's see. Umesh, Naveen, Yash Dubey, Jyoti Meena, Sanjeev, Kranti, Gauri, Jitu Meena, Priya, Raja Siddiqui. Yes, almost everybody is correct. So let's have a look of hypovolemic shock in class 1, 0 to 15, class 2, 15 to 30, 3, 30 to 40, class 4, 40. Okay. Now the pulse rate in class 1, it is less than 100, but what happens from class 2 onwards, it becomes more than 100. Class 3, 120, 140. BP is normal. In which classes? Class 1 and 2, BP is normal. Pulse pressure is normal in class 1. In rest 3, it is decreased. And urine output, it was asked that urine output starts decreasing in which class onwards? Class 2 onwards, urine output starts decreasing and it becomes negligible. Negligible urine output is there. Where? In class 4. And generally we have to give crystalloids in class 1 and 2. Apart from that, blood transfusion in class 3 and 4. So this is very, very important. And what is the definition of shock? It is a syndrome caused by hypoperfusion of peripheral tissues. Okay. We are expecting a question on the sutures also. Tell me what is the correct answer for this question. Fluid of choice in shock, overall it's a ringer lactate. Tell me what is the correct answer for this question. Read the question. A surgical attending has completed a modified radical mastectomy for a carcinoma breast. You have to suture the wound using subcuticular sutures. So which suture is used for subcuticular sutures? Which of these three should be used? What is the good thing about sutures? The name of suture is mentioned or it's written on the packet. So the name is written on the packet. You can read the names. Here it is written monocryl. Here is written mersilk, which means it is silk. Here it is written vicryl. This is vicryl. And here it is chromic catgut. So tell me which one? Which one? Yes, everybody is marking monocryl. Monocryl. What is the other name of monocryl? It is also known as polyglycaprone. Monocryl is also known as polyglycaprone. This is absorbed in 120 days. Usually absorbed in 90 to 120 days. Polyglycaprone or monocryl, and especially it is used in plastic surgery for subcuticular suturing. Okay? Silk, it is used for skin suturing, and you know that silk is black in color. This is for skin suturing. This is non-absorbable suture. What's the role of vicryl? Vicryl is absorbable suture. In how many days? It is absorbed 60 to 90 days. Even chromic catgut, it is absorbable. In how many days? It is absorbed 60 to 90 days. Clear? So correct answer is A here. A is the correct answer. We are expecting questions related to sutures. Just by looking at the packet, you can identify, because it's written on the packet. It is catgut. Catgut is yellow. Who discovered catgut? John Hunter. John Hunter, and you know it is prepared from submucosa of sheep gut. Submucosa of sheep gut, which part? Ileum. Again, in how many days? It is absorbed 60 days. And you know we are using one preservative in catgut. And what is that preservative? It is isopropyl alcohol. We use a preservative that is isopropyl alcohol. Vicryl is used for three structures mainly. Mnemonic is cub. The organs in which there is stone tendency, like CBD, ureter and urinary bladder. In CBD, ureter and urinary bladder, we are using vicryl. So this is vicryl, violet in color, and here you can see the blue colored proline, also known as polypropylene. You know what is the role of proline? Proline is used for vascular anastomosis, and it is used for suturing of rectus sheath. Vascular anastomosis and rectus sheath. So this is for vascular anastomosis, and it is used for rectus sheath. Rectus sheath, proline or polypropylene. Clear? These are potential questions related to sutures. Another integrated question. Read it. Tell me the correct answer. Yes, Gauri, you are correct. Tell me correct answer. I'm waiting for you guys. Waiting for the reply. A 60-year-old male presented with painless compressible swelling in the right side of neck. On the right side of neck, painless compressible swelling. You know that vascular swellings are compressible swelling. What is the diagnosis based on the given image? This is angiography. You can see internal and external carotid, and what happens in internal external carotid? There is a mass here, and because of this mass there is splaying of internal and external carotid, and this splaying is known as Lier sign. This splaying is known as Lier sign. Clear? So Lier sign is seen in which condition? Chemodectoma. Chemodectoma, also known as, what is the other name? Carotid body tumor. Chemodectoma, it is also known as carotid body tumor. See the exact location, how the tumor looks like. Here is the location. This is the tumor. And here you can see the location of tumor. That's why what happens? There is splaying of carotid. And because of this splaying, you can see here, this sign is seen. This is what? This is Lier sign. Splaying of carotid, this is known as Lier sign. So this is chemodectoma, carotid body tumor. Next question, very important question. Many times this kind of image based question was asked. Tell me what is the diagnosis just by looking at the image. Tell me what is the diagnosis just by looking at the image. Yes. Everybody, all of you are marking correct answer, that is C. Very good, it's glioblastoma multiforme. Another question for you people, what is this appearance? It is looking like what? Tell me. What is this appearance? It is, oh, Rameshwar Nayak is sending a butterfly for you people. Rameshwar Nayak is sending a butterfly. This is butterfly tumor. Why it is butterfly tumor? Because tumor crosses midline. So read the question. A 25-year-old male presented with morning headache, typically of brain tumor, projectile vomiting and seizures. All these findings suggestive of brain tumor. MRI was done. What is the diagnosis based on this radiological imaging? So this is glioblastoma multiforme. It is known as butterfly tumor. Why it's known as butterfly tumor? Can you see here? It crosses midline and typical appearance, there is central necrosis with ring-like enhancement. There is central necrosis with ring-like enhancement. It is seen in glioblastoma multiforme, and you know it is grade 4 astrocytoma. Which one? Grade 4 astrocytoma is the glioblastoma multiforme. This is having worse prognosis and most common type of astrocytoma in adults. Glioblastoma multiforme, most common type of astrocytoma in children, and that is pilocytic. Pilocytic is having best prognosis in astrocytomas, worst prognosis glioblastoma multiforme. So correct answer is C. So these were the important topics of NEET PG Marathon Part 2. Best of luck guys, don't lose hope, keep studying. Yes, your performance at the end, have you seen marathon? When somebody is running marathon, especially at the end, they increase their speed. So what you do, you increase your study time at this point of time. It will help you in getting better rank. So don't lose hope, keep studying, and definitely you are going to crack this NEET PG 2023 with flying colors. Best of luck everyone.
Yes, sir.